Our general society has to be aware this is not an infectious thing. Suppose if they have a fear of, and many patients of the cancer relatives comes to us and they ask, and it is genuine question, whether the small kid in the family will develop this thing, because we know that tuberculosis, if somebody comes in contact, that can be the immediate contact can get an infection from the person who is infective stages. But in tuberculosis, after giving the tablets, within few days the patient becomes non-infectious. Maybe no, he cannot transfer the infection to other. But in lung cancer, it is not infectious. Even in tuberculosis with the treatment, patient's infection doesn't spread. But in lung cancer, there is no spread from person to person. So why to have the stigma when it can be treated even in stage 4? But yes, the word cancer, not only lung cancer, there is a stigma associated with it. Stigma in the sense people feel that cancer is death. So it is absolutely wrong. Cancer is not death. With the evolving treatment modalities, these are patients living longer. I must say, once the cancer is diagnosed, the way of looking at life changes. Patients become more positive. They have time in their hand. I can say proudly, they know that I have this much time. They can live the life in a good way. If you look at I always tell my patients, compare the accidental deaths and the cancer deaths. You have time in your hand. Do the things in a positive way. When we have ample of time, we waste that time. And when my patients have 5 years, say 10 years, they do utilize it in a systematic way. They know the importance of each and every second. They live the life happily. Now it is very important who is your caregiver. He has to motivate these patients. Not only the oncologist, you have a team of volunteers who are involved, social workers, supportive groups like NGOs, they provide funds. There are certain cancer can be 100% cured. So then the finances become the problem. Patients are poor, they don't have money. So there are NGOs, there are people who are supporting. Those patients who are got cured from my side, they come and tell me, I want to help. If some patient doesn't have money, you feel that doctor he needs, they are ready to support us. There are NGOs. So it's not only my job or the family job. The whole society should be have awareness about these things. Everybody should come forward. This is a bad evil. Everybody has to contribute in this fight against this cancer. Everyone has to understand. Then it doesn't become a stigma. It's not a stigma.